Why cataract surgery results can sometimes be disappointing and how to address these issues. Are you struggling with blurry vision after cataract surgery? Or maybe you're worried about the results before even going under the knife. You're not alone. Cataract surgery is one of the most common and successful procedures out there, but not everyone walks away happy with their vision. In today's video, I'm going to reveal why some people feel let down after cataract surgery, and what you can do to address these issues. Whether you're experiencing dry eyes, nighttime glare, or just not seeing as clearly as you'd hoped, I'll explain the common issues, and more importantly, how to address them. So, stay tuned as we dive deep into the world of cataract surgery and how to ensure you get the best possible outcome. What is cataract surgery? Cataract surgery is a common procedure to treat cataracts, which are cloudy areas in the lens of the eye. During the surgery, the cloudy lens is removed and replaced with a clear artificial lens. This helps restore clear vision for most patients. However, there can be complications that affect the outcome. Common issues after cataract surgery. So, what are the most common reasons people aren't satisfied after cataract surgery? One of the most common complaints is dry eyes. In fact, research shows that up to 42% of people experience some degree of dry eyes after cataract surgery. Now this might sound surprising, but it's actually quite normal. Before surgery, you might associate dry eyes with feelings of itchiness, grittiness, or irritation. But after surgery, dry eyes can feel a bit different. Some people don't notice the discomfort as much, but instead, they experience blurry vision or a fluctuation in how clear their vision is throughout the day. So, why do your eyes get so dry after surgery? There are a couple of reasons. First, the eye drops used before and after the procedure often contain preservatives, which can be harsh on the eyes. Also, surgery itself causes some inflammation on the surface of your eyes, and this can lead to temporary dryness as your eyes heal. If this sounds familiar and your dry eyes are really bothering you, don't just suffer in silence. While dry eyes after cataract surgery are common, it's important to talk to your eye doctor. They can recommend treatments like artificial tears, prescription eye drops, or even procedures that can help keep your eyes more comfortable and your vision clear. Dry eye may not go away completely, but managing it can make a world of difference in how you see and feel. The next big factor that can affect how happy you are with your surgery is the type of lens that was put into your eye. Not all lenses are the same, and if your surgeon chose a lens that doesn't match your needs or lifestyle, you might not get the results you hoped for. One lens option that can sometimes cause dissatisfaction is the multifocal lens. This lens is designed to help you see at multiple distances without needing glasses, but it can come with some trade-offs, especially at night. A common complaint with multifocal lenses is nighttime glare. Some people have trouble adjusting to this, especially if they have a history of other eye surgeries like LASIK or PRK. While some people are okay with a little glare, others find it really disruptive. If you're experiencing glare or other issues with your lens, talk to your doctor about options like anti-glare glasses or eye drops that can help reduce the problem. In some cases, if it's a serious issue and caught early, your doctor may even suggest a lens exchange to replace the lens with a different one. Another issue that can come up is related to the focal points of your eyes after surgery. Sometimes during cataract surgery, one eye is set for distance vision and the other eye for reading. This is called monovision. While a lot of people adjust to this setup just fine, others struggle with the difference between the two eyes and find it hard to balance their vision. If you're having trouble getting used to this, you're not alone. It's really important to speak up if this is affecting your daily life. Solutions can include glasses, contact lenses, or even additional surgeries to adjust the focal points in your eyes. The key is finding what works best for you so you can get the most out of your vision. Unrealistic expectations. Now this is a big one, expectations. Sometimes people go into cataract surgery thinking they'll have the perfect vision they had in their 20s. And while cataract surgery can definitely improve your vision and make life a lot clearer, it's important to remember that no surgery is perfect. Your new lens won't give you the exact same vision you had when you were younger, and you might still need glasses for certain tasks, like reading or driving at night. The key to being satisfied with your surgery is understanding that while it will improve your quality of life, it won't give you perfect vision. You may need to compromise, whether that means prioritizing clarity or range of vision. Lastly, cataract surgery may not solve all your vision problems if you have other eye conditions. For example, if you have glaucoma or macular degeneration, these can affect how well you see after surgery. Even with a perfectly placed lens, these issues can still cause vision problems. Discuss your overall eye health with your doctor to understand what your results might be like. If you're feeling disappointed after cataract surgery, don't panic. There are steps you can take to improve your vision and comfort. Whether it's adjusting to dryness, addressing lens-related issues, or managing your expectations, there are solutions that can help. Remember, cataract surgery is still one of the most successful surgeries performed today, and the vast majority of people are happy with their results. If you're not one of them, the first step is to talk to your doctor. Together, you can figure out what's going on and find ways to make your vision clearer and your life more comfortable. Thanks for watching. If you have any questions or experiences you'd like to share, leave a comment below. I'll be happy to answer them. Don't forget to subscribe for more health tips, and I'll see you in the next video.